Today I'm going to be talking to you about the condition named tendonitis. Tendonitis in itself is really a single term for many different issues that can occur all over your body. But in general, the definition of tendonitis is any inflammation that occurs in a tendon. And a tendon is something that attaches your muscle to your bone. So if you have any inflammation from overuse, that can be called tendonitis. Any age this can occur in, and if you are younger, most often it will occur during sports or any kind of physical activity. If you're older, then usually that's more of like a wear and tear situation, where over time the tendon actually thins out and gets weaker and then gets inflamed. And then also a couple of diagnoses such as diabetes mellitus or rheumatoid arthritis you are predisposed to tendonitis more so than others. So symptoms, how do you know if you have tendonitis? Pretty much if you have pain with movement. If you are performing an activity or sport and you just notice that either during that activity or right after the activity, something is bothering you where the end of that muscle is right before it hits the bone that it's attached to. If you notice any swelling, redness, or heat around the area, that could be an indication of tendonitis as well. Also, sometimes there can be a lump in the area, just a small lump, and that's usually just from the active inflammation process. It doesn't mean that there's necessarily a tear in anything, because tendonitis technically is not a tear in the tendon, it's just the inflammation. But when that inflammation system starts up and gets started, then you will notice sometimes there may be a little bit swelling, and that's the lump that I'm talking about. The other thing is some people notice some kind of cracking of the tendon, kind of like when it rubs over a bone or something like that, and that can be normal as well. Impact. So how does this impact your daily activities? So first and foremost, that if you have a tendonitis and you are having it over a repeated amount of days and you continue to not listen to the warning signs of your body and you continue to play your sports, it can get worse and worse and worse to the point where you might actually tear the tendon. So it will limit your activities with your sports. It can also limit normal daily activities. So if it gets too painful, it can affect your ability to walk longer distances. It can affect your ability to reach overhead into a kitchen cabinet if it's in your shoulder. And also it can affect your ability to get dressed. So putting on a shirt overhead or being able to sit and put pants and socks on, it can also affect that as well. It can also affect your job. So if you have a heavy labor type of job, whether it's lifting or it's repetitive movements like construction, if you use like certain machines, anything like that, it can then also limit your ability to perform your job because you'll always be in pain and you'll always have some inflammation going on and not enough time for it to heal. So that's how it can pretty much impact your life. The next thing I wanted to go over were 3 different kinds of tendonitis, and these are the most common forms that we see in physical therapy. The first one is Achilles, and the Achilles tendonitis is the Achilles tendon. Where's the Achilles tendon? The Achilles tendon is the bottom of your calf muscle, and it attaches to your heel bone. So we're talking that big, long tendon that's in the bottom near your foot. What can happen? So sudden increase in exercise. If you were all of a sudden going to the gym 4 times a week and you normally never went to the gym, that sudden increase in exercise might put this excessive stress on the tendon in the back of your ankle. You might have a really, really, really tight calf and notice that when you're walking, you try to push off on the front of your foot and it feels like your calf is almost on fire, it's so tight. Another thing that can cause Achilles tendonitis is a bone spur. So on the back of your heel, which is called the calcaneus, sometimes these excessive pieces of bone form on the back of the heel, and if that continues to grow and grow and grow and gets bigger, it will start rubbing on the Achilles tendon at the bottom towards your heel, and you'll have lots of pain and inflammation there. The next one I wanted to talk to you about was tennis elbow. And no, you don't necessarily have to be a tennis player to actually get tennis elbow, but it is that movement of moving the arm across the body as if a tennis player were hitting the tennis ball in backhand form. So just kind of like that. So the pain you would feel is more on the outside of the elbow. So we have our wrist here, and then the muscles come across and they attach pretty much right there. So it's where this muscle here, or muscles attached to that bone there, is right at that spot. So you'll notice that you have a lot of soreness and tenderness to that muscle over there. specifically a lot of point tenderness when you try to push there. You might also notice that if you use your wrist and you go to kind of flex your wrist down, which is stretching that muscle, that will put a lot of tension on that area there, and you might notice that it's pretty sore. If you go to use a hammer or you're doing weights or something like that, bringing the wrist up in this position with weight will also cause that tendon to be sore there. The third and final kind of tendonitis I wanted to talk to you about is patellar tendonitis. So patellar meaning your kneecap. So on your knee, the patella is right here. Right underneath that patella is a patellar tendon, and that tendon attaches your kneecap to your shin bone. And after that, if there's a lot of overuse, and that usually involves a lot of jumping kind of sports, whether it's volleyball or basketball, and you're putting a lot of stress by jumping off of that leg, you might have some tendonitis in that tendon there. And a lot of times, because you're doing a lot of jumping, and you might not necessarily be strengthening those muscles around the knee evenly, there will be some muscle imbalances. So you might end up having a really strong quadricep muscle, which is that front of the thigh, compared to the hamstring, which is the back of the thigh, or vice versa. Most people are quad dominant, but occasionally if somebody has a really strong hamstring and not enough strength in the quad area, there will be an imbalance there, and that might be pulling some abnormal tension on the patellar tendon. Your kneecap tracks out and in as your knee, or your leg, actually your lower leg kicks out and in. So when that happens and there's an issue with how your kneecap is tracking, that might put some abnormal stresses on that tendon. So that's how patellar tendonitis might happen. How does PT help? So PT can help because we can specifically evaluate the area involved to make sure that it is just tendonitis and that it's nothing serious. And then we can guide you correctly as far as treatment is concerned, because physical therapy can help tendonitis very much so, and we can help with strengthening and altering those muscle imbalances and then helping your stability so that you can return to your active sports routine or exercise routine. We can address any correction in form. So as far as if going to the gym and you're working out and you're not sure you're doing things correctly there, we can help you with that. We can give you cues on how to protect. For instance, if you're doing a lot of squatting with weight, we can make sure you're not putting abnormal stresses on your knee. We can help you with the tennis backhand and make sure that all the muscles around there are strong and there's no muscle imbalances there as well. So anything that has to do with correcting form or technique, we can help you with. If you ignore these symptoms, inflammation will just continue to go on and on and on, and things will definitely get worse, where you then might thin the tendon out so much that it actually tears, and then you will be unable to participate in the sport or do the things that you love, such as gardening or playing outside with your grandkids or anything like that. So it's something you don't want to let go, because if you catch it early, we can handle it early and you can get back to those activities a lot quicker. The other thing is that you might not be able to go back to work, because if you have a very heavy labor job and you need to use your arms and you can't use your arms, you're going to be out of work. So that's a big deal, and we don't want that to happen. You want to handle it right away. If you have any questions, you can call us and we can get you to come in and look at it and assess the situation. And remember, it's not always no pain, no gain. So that's really important to know, is that if you have pain, that means something is wrong, and that is a warning sign, and that is telling you that you need to get it checked out.